Hello, everyone. Thank you for being with us this afternoon. My name is Irina Polanco-Ventura, and I am the Director of Public Health Initiatives at the Partnership for Maternal and Child Health. Today's webinar is entitled Concerning Dads, Postpartum Depression and Fathers. This is the second talk of our four-part series, which focus on topics related to perinatal mental health. We'd like to thank the New Jersey Department of Health for funding these informative and important programs. During this talk, we will be muting all attendees' phones. However, please feel free to use the chat box for questions and the speaker will respond to as many as possible at the end of his presentation. To receive a certificate of completion, you must listen to the entire webinar and complete the evaluation survey. An hour after the webinar ends, you will receive a link to a post-program evaluation. Please complete the survey to provide us with feedback on the program. Certificates will then be sent via email within 1 week of the webinar. Also, the recording for this program will be available on the partnership's YouTube channel. Now on to our speaker. We are so glad to have Dr. David Levine leading this webinar today. Dr. Levine is a pediatrician at Summit Medical Group in New Jersey and serves on the board of Postpartum Support International, helping fathers across the U.S. deal with postpartum depression. He is a fellow of the American Academy of Pediatrics and has been featured in the New Jersey Family, New Jersey's favorite kids docs listings. When he's not working with his patients, Dr. Levine enjoys family time at home, movies, New York Mets baseball, New York Rangers hockey, New York Giants football, and plotting to take over the world with his son and daughter, while mom is not looking, of course. Thank you today for being with us, Dr. Levine.
Thank you very much. I want to say thank you to the partnership for inviting me and for everybody who is attending today. So my talk is concerning dads, postpartum depression, otherwise known as PPD, and fathers. Here are the disclosures, information for everybody to take a quick look at. All right, I'm immediately regretting this decision. For those of you who know Ron Burgundy, this is a quote from Anchorman. It's a funny line, but it's also something I think a lot of parents of both genders may feel as soon as they realize that they now are parents. And I know it is something that I felt when my son was born. Another quote, which is from Michael Lewis, the author of Moneyball and The Big Short, is that maternal love may be instinctive, but paternal love is a learned behavior. And I don't think that this is unique to myself. I think a lot of fathers do feel this way. And hopefully after you listen to my presentation, you may understand a little bit why. So how do you go from this, which is myself and my son on day 2 of life, to this? So our objectives are to understand that postpartum depression and anxiety occurs in fathers, how postpartum depression differs in fathers and mothers, and what to do if you find a dad who is suffering from PPD. My daughter got me a world's best dad mug, so we know she's sarcastic. So this is what I call the lie that we tell. These are all pictures of families that are together, and in one case, families that are a mother who is working. We as a culture tell ourselves, and then we tell everybody else, that you can be 100% parent and 100% worker, and it's a balance that anybody and everybody is capable of doing. When in fact, the reality is very, very different. The culture tells us that we can have it all. If we don't feel that way, we are to blame. Blame leads to shame. Shame leads to depression. We pathologize depression as a personal failing, which is a very popular thing in this country especially. We do not therefore get help. Because after all, if everyone else can do it, why can't I do it? Which is something that we all feel. We all look around and we see other people like, well, they seem so much happier. They have it all together. If I don't have it all together, it's got to be something that I'm doing wrong, because look at how happy everybody else is. What's the matter with me? Am I less of a man? So what is a man? You know, men are supposed to be rocks, or the rock, something about a rock. We're supposed to be there for our spouses. We're supposed to be immovable objects who are there when the going gets tough. So there's a lot of myths and legends. So one, of course, big myth is that men can't get postpartum depression. Why? Because postpartum equals maternal, which is not true. that it is only caused by body changes, which if you've ever seen a man during his wife's pregnancy, our bodies change too before and after. That's only caused by hormones, and that new dad's hormones don't change. So by the numbers. This is all data from the census and from fatherhood.gov. That as of 2013, there was estimated to be 70 million fathers in the United States. There were roughly 24.7 million married with kids under the age of 18, at least 2 million single fathers, and probably much more than 214,000 stay-at-home dads. Postpartum depression in men is estimated to occur in 1 in 10 fathers. It's probably more than that. There are some studies that say that it's probably about as common as it is in women, which is considered to be 1 in 5. So if we just take 1 in 10, we know the biggest predictor is maternal postpartum depression. Conservatively, that means that about 2.5 million fathers may have or had postpartum mental health issues. And how many of you out there have had any examples of this? And believe me, up until a certain point in my life, I had never heard of it or never seen it either. This is the obligatory slide that summarizes everything. Easy to come back to. We'll get to it, don't worry. So first, let's tackle hormones. Men actually have a decrease in testosterone, an increase in cortisol, an increase in estrogen or estradiol. Men have female quote unquote hormones just like women do, just like women have male hormones. We have increases in vasopressin, and we have increases in prolactin and oxytocin. The dysregulation of any of these hormones or any of the receptors in key areas of the brain may, and I stress may, serve as a biological risk factor for mental health. The same thing could be said for women. It's not that you have differences in these and you absolutely will suffer from postpartum depression or anxiety, but there may be some connection to them. And these are changes that happen in our bodies just as much as it happens in women's bodies. Dad, our relationship means the world to my therapist. So many of you may know that mental health, the symptoms of mental health do not necessarily look the same in males and females. And in fact, there is something known as male mass depression. It involves certain characteristics that are different than you would see in women. Lower stress thresholds, increases in substance abuse, lower impulse control and aggressiveness, feelings of emptiness, irritability, sleep problems, again, feeling of anxiety, very, very similar, but also abusive, hyperactive, and antisocial behaviors, criticizing, and the withdrawal response. Many men will go from drinking a beer to drinking a 6-pack. We will go to the man cave. We will kind of disappear, work, later hours, or just not make ourselves as available as we might normally be. And some might say, oh, he just needs some time, but it actually may be something more than that. Paternal anxiety disorders, contributing factors include the work-life balance, lower threshold, lower relationship satisfactions. I want to specifically focus on the witnessing of birth trauma, which may not be what you think it is. So birth trauma to some people might be, well, having a something go wrong during the birth or having a premature baby or something like that. But in fact, birth trauma to some men can just be witnessing an actual planned C-section or even a natural birth. Men are not necessarily prepared to see some of those things, and it can be very traumatizing to us. Low parental self-efficacy, which we will get to later. Highly comorbid with depression. So it is recommended to assess and measure both anxiety and depression. So why are men having problems? Well, as we were talking about with The Rock, masculinity definitions have really not changed since the 50s. Although you may ask younger men today what they feel like would describe a man, when push comes to shove, it still comes down to suppressing feelings, to be a man, to suck it up. That aggression is still valued by our culture, and we pathologize depression, unmanly men, wusses, that kind of stuff. A Perry Undum survey in 2018, only 2% of males said that honesty and morality are valued by society, and that's specifically American. Fathers in general speak with less emotional nuance than mothers do, regardless of their child's sex. Boys are raised to be shame-phobic, convinced that they will lose peers' respect if they discuss personal problems, especially from their fathers. So you are raising young men to not be able to express themselves, to feel that any expression of their feelings may be viewed as weakness, and then they become fathers and they have problems and they are not equipped to deal with those and to tell anybody about them. In the Atlantic magazine in January of this year, there was an article called "What It Means to Be a Man." And there's two quotes I'm going to share. One is, men who adhere rigidly to certain masculine norms are more prone to binge drinking. Remember, I mentioned substance abuse, risky sexual behaviors, and are less happy than other guys with higher depression rates and fewer friends whom to confide. Boys are taught that women are responsible for emotional labor, for processing men's emotional lives in ways that would be emasculating for them to do themselves or with other men, and that dependence can leave men unable to identify or express their own emotions. And if we have seen anything in the last several years, men who cannot identify or express their emotions can be very, very dangerous. This has a profound effect on family functioning. It can lead to insecure attachments with children, leading to children's emotional problems, behavioral issues, including conduct problems and hyperactivity. In JAMA Psychiatry in December of 2018, they found that there was an increase in depression in teenage daughters if the dad was depressed postpartum. Increases in parental conflict, which can lead to domestic violence. There's some studies out of Scandinavia that looked at domestic violence issues in homes, and they found that there was increases after the birth of children, even in homes where there had not previously been any domestic violence. And to say nothing about what's going on in our current environment with the shelter in places and quarantines due to COVID-19. There is decreases in parental support and decreased parental satisfaction leading to divorce, none of which are good for the family. There's also lateral violence, which is basically what we were just talking about, displaced violence directed against a peer or loved one rather than the source of the pain. So you take men who are not able to express themselves, not able to understand their emotions, so they displace their aggression onto others, whether it be their spouses or their children. You're the world's greatest dad, although my frame of reference is limited. So the 50s dad. So again, what is the heart of this? So we'll say that his name is Don. He works for a marketing firm in the city. He enjoys a cigarette and some scotch. He probably fools around with the women in his office, likes to go out with the guys after work. And when he does come home, he expects a meal being made, to be able to watch the game or listen to the game. He'll be there to talk to his kids and find out how their day was. But if there's homework to be done or diapers to be changed, he's probably not doing them. And that's okay. That's the way his father was. That's the way his grandfather was. And that's what his expectations are. Then you have the 50-50 dad. His name is Alan. Alan likes to be a part of his son's life. He wears his son. He takes him to Las Vegas. He has a good time with him. He expects to be a part of his son's life, and in ways that Don in the 50s did not. But they were both raised by fathers who weren't necessarily, well, in the 50-50 dad's case, they were raised by the 50s dad. So they're kind of making it up as they go. And this you can see from The Economist back in 2017, childcare, daily childcare from 1965 till 2012 has changed dramatically. For women, it only went up by 10 minutes, but for men, it went up almost an hour. We are, for various reasons, taking a lot more time with our kids, and we want to. We feel very strongly that this is a part of our responsibilities with our children. Some more information from the Pew study. 48% of men feel that they spend too little time with their kids versus only 25% of women. 39% of men feel that they do a very good job raising kids versus 51% of women. Another reason why fathers are more involved is the changes in incomes. Back in 1970, there were single income families were almost half the families. Now it's only a quarter, and dual incomes have gone up considerably. So not only do we want to, we have to. The public, however, has very mixed views. 41% think it's extremely important for men to provide the income role. Only 25% think it should be a mom. Increase in work, but not increase in support. And then there's also, as I mentioned before, self-efficacy, our abilities as men to feel like we're good at something. Well, there's something known as maternal gatekeeping, which is the mother's protective beliefs about how much and whether a father should be involved in their children's lives. It also involves the behaviors between parents that either support or restrict co-parenting. If a father is trying to help, is not allowed to do so, or is chastised, it can lead to trouble, especially when most of us do not have a role modeling for this behavior. I can tell you about several instances in my office as a pediatrician where the father would be trying to do something and the mother would say, no, you're doing it wrong, or, kind of criticizing the father. And, it might be silly or funny or whatever in the situation, but if that happens all the time, it can lead many men to feel like, well, I can't do this. Like I don't feel like I know how to do this. You're not telling me how to do this. You're just criticizing how I do it. And it causes us to shut down even more, especially at a time when we so desperately want to be able to do it right. 52% of dads feel it is very or somewhat difficult to balance work and life. And I should also say that none of this is meant to minimize what women have known for generations. But this is, for better or worse, this is new to many men. 29% always feel rushed. Society still views women and moms as better equipped to care for children. 59% feel that a stay-at-home parent is best. Almost 50% say it should be mom, only 2% dad, but 50% did think it doesn't really matter. There's also different attitudes towards work and time off versus family and versus other countries. As we all know, the US has the least family leave time of all developed nations. In a Pew survey of 2017, 71% said that babies should have equal time for bonding with both parents. However, 27% said it is more important to have that with mom, and only 2% with dad. Maybe this is why. So the average maternal leave in the United States is 11 weeks. Now, granted, this is average, and we know many who have none, but for paternal leave, it's only 1 week. 49% say employers put more pressure on fathers to return to work quickly versus 18% of mothers, and a third say it is equal for both parents. England has realized that there are major societal consequences for mental health in men. And in 2018, the National Health Service updated its guidelines to require providers to screen fathers as well as mothers for postpartum mental health issues, realizing the damaging effects on the family. Dad, you've always been like a father to me. So I don't know how many of you out there are baseball fans, but I'm in New York and New Jersey area, and Daniel Murphy used to be a New York Met. He helped lead us to the World Series in 2015, wanted a big contract after having been a good but not great player, got a big contract from the Washington Nationals, and then had two nearly MVP years for the Nationals, and every time he played the Mets, he beat the crap out of us. So I don't really like him that much. But in 2014, at the start of the baseball season, back in the era when we had live sports, he dared to miss the first 2 games of the 2014 season because his wife gave birth to their child. And if any of you are in this area or know Morning Drive radio on WFAN, the Morning Drive crew and the afternoon person both made fun of him, saying things like, that's a mother's job, how dare you miss the games, I could see maybe wanting to see the kid, but why are you taking time off? It's the beginning, this is not the preseason. He basically took a lot of crap for this. It made it to the newspapers. The Morning Drive person did apologize for it, but the afternoon drive person did not. And this is just an example of the cultural machinery at work. This is a man who all he did was miss some time to be with his kid, and he was shamed. And if other men are listening to the radio, which they do, and they're reading the sports pages, and they see this, and they were thinking about doing it, and they see the crap that this guy takes, they're like, well, I'm not going to do that. As a sign of some improvements, in 2019 in the playoffs, also involving the Nationals, one of their relief pitchers, Hudson, missed the first playoff game and was praised for it. And they brought up what had happened to Daniel Murphy 5 years earlier. And there was definitely a lot more of the players even coming out saying, hey, you know what? Being a parent is just as important as playing this game. And if this guy wants to take some time, he should take it. And that is a sign. I was a part of a video that was done called New Dads Get Postpartum Depression Too. It was a compilation of fathers talking about their experiences as new parents, including some reality TV quotes from some men who had said that it was very hard. And again, as an example of the generally terrible nature of social media, this is what happened. So we're all adults here, so you can see some of what was written in the comments section, which of course you should never read. Whiny little bitch. This is not postpartum depression. This is just a jerk who doesn't want to take responsibility. How can they suffer unbalanced when they give birth? Again, stating that a man cannot possibly have these issues if they're not the ones who actually carried the baby and had the child. And just a bunch of old men who can't handle a baby. So again, this was a video put out there to just try to educate people and express to them that sometimes men can have these issues too. And although there were some comments that were nice, a lot of the comments were things like this. A lot of them were, this is just a bunch of babies. Which leads me to the first time I thought I might hurt my son. So my son was born in October of 2013. I was very excited to become a father. I had no previous history of anything other than some anxiousness that was with a relationship related. I had no problems at the birth of my son, and my wife experienced some postpartum blues afterwards. But then once her blues got better, I started to feel things that I did not understand. I had actually taken the second and third week of my son's life off from work to be home to help out with my wife and the baby, and my wife was on maternity. And it was during those 2 weeks that I started to get very stressed around my son. And I started to believe that there was something wrong with him. I truly believed that something was the matter because he always cried. He cried constantly. My wife was like, no, he doesn't. And I said, yes, no, he cries all the time. Like, he did not stop crying. He even cried so much in the hospital when he was born that we had him in the nursery just so we can get a little bit of sleep because we'd been there overnight. And they actually brought him in because he would not stop crying. And I just couldn't get out of my head that this was somehow a sign of something, even though my son's pediatrician, and I am not my child's pediatrician, said to me, Dave, he's a day old, you know, they cry, don't worry, he's okay. But during that time, it was still very difficult. When I was at work, I was okay. And when my wife needed me, again, going back to wanting to be the rock, like I have to be there for her, I was good. Like, we were working through breastfeeding and formula, and I felt like I had a purpose. And then once that was fixed and my wife felt better, I was trying very hard to be that 50-50 dad, and I felt like I was failing miserably. I could change a diaper, but I could feed him, but he cried. And I felt that he cried more with me than he did with my wife. And I felt a profound sense that I was being rejected by my son and that he hated me. I really felt this. This brought out some aggressive behaviors on my part, not against my wife, but against my son, verbally. I would get angry with him and I would put him down and I would say mean things about him to my wife. And she didn't understand where it was coming from, but she just felt like, you know, things will be okay. There was one time during that week 2-3 where he was crying and my wife was going to take a shower, and I just was putting him down into a mat so that he could just kind of like turn on a mobile to play. And I thought that I had maybe put him down too aggressively, and I got it in my head that I had shaken him. And then I thought, oh my God, he can have shaken baby. Even though I didn't do that, I know what shaken baby is. But at the time, just putting him down, I thought I had done something wrong. And when my wife got out of the shower, I just walked out of the apartment. We were living in Jersey City. I went downstairs and I just walked around the park for like an hour, just thinking, oh my God, what have I done? What have I done? It was during this time that I also realized that maybe there was something going on. And I did mention it to one of my doctor, and he did prescribe a Zoloft for me, which I took for like a week, but I felt like I don't need this. You know, like even as a, you know, many of you know, doctors make the worst patients, and I just felt like I'm not depressed. I don't need to take this medication. I Googled postpartum depression in fathers. I found very little information. I found support groups, but they were for women and they were always during the day. And I felt like that's not for me. I didn't find anything for men. So I go back to work starting week 4, and I'm okay at work. I'm not sleeping because, again, 50-50 dad, we've arranged it where we'll take shifts with sleep, so we can hopefully get, you know, my wife will feed him at 9 o'clock. He'll sleep until 12. I'll get him at 12, feed him, put him down. My wife will get him at 3. I'll get him at 6. But my wife feeds him at 9 and goes to bed, but I don't go to bed because I don't want to be woken up. So I wait with him. He sleeps. I watch some TV. He wakes up around midnight. I feed him, but it doesn't go right down to sleep. So it could be after 1 o'clock that I finally get him down, but I don't put him down to his crib immediately because I don't want him to wake up, because I really want my wife to get sleep. So I wait with him another 15 minutes. I put him down to his crib, but I don't go to sleep because after he's in his crib, I want to wait a little bit longer to make sure he's really asleep. So now it's like 1:15, 1:30, I go to sleep. So and then I hear him at 3, and then I'm up at 6. So I have not slept 6 hours. I've slept 4.5, maybe 5 hours. And eventually, you know, this takes its toll. But I'm doing all right at work. At least I tell myself I am. I'm eating. I'm not losing weight. I can sleep. I'm thinking about all the signs of depression and anxiety that I know. I don't feel like I have any of those things. I'm just really angry, though. Very, very angry. And I come home, my wife gives me my son, and he starts crying immediately, and I just take him back. I'm like, get him away from me. I hate him. I don't want him. And again, I'm saying really mean things, and my wife just doesn't understand. And then it's week 7, and it's a rainy day. I think probably it was a Wednesday or Thursday. And that weekend we were supposed to have my in-laws come over so we could so they could watch my son, so my wife and I could go run some errands and maybe go to the movies. And so that morning I must have said something particularly mean-spirited, that I had said to my wife that this kid's going to be the end of us. He's going to destroy our lives. And if you think this is bad at 2 months, it can't wait till he gets to 2 years. Like we'll never make it. And I leave in anger. I get in the car. It's pouring rain. I'm driving to my office. I call my wife on the phone just to make sure that we're okay for the weekend. And I think I hear her say, "No, we're not." And I just start crying. I'm just bawling my eyes out in the car, because I think this is it. It's over. This is exactly what I knew would happen. He's destroyed my life. He's destroyed my marriage. I've destroyed my life. I've destroyed my marriage. Now my wife did not say no. She said yes. I just didn't hear her over the phone. But now she's crying and she says, "Dave, you need to get some help." And I said to her, we need a night nurse. I need to get some sleep. So she gets on top of that. I get to work. I call one of my good friends who's a ER doc in Philadelphia in children's. He has 2 daughters, and I finally get him on the phone and I tell him what's going on. And he tells me that he understands because, you know, he has 2 kids and it was hard for him to kind of get up to speed with them and feel like he knew what he was doing. He didn't feel the way I was feeling, but he did understand. And he's like, you need to get some help. Now, luckily at the group that I work at, we have behavioral health. And I was able to find somebody who actually specialized in postpartum depression, and had actually taken the course at PSI for that. I didn't know that at the time. Nothing about fatherhood, but I'm like, well, if you know postpartum depression, hopefully you can help me. And so I got on the phone, I emailed them and got an appointment the following week. And my wife gets a baby nurse who's going to start on Sunday. And we make it through the weekend. And I start my therapy, and we have the baby nurse who gives us a lot of good pointers and helps us get some sleep. But floating out in the future, I take a paternal leave. So my wife is going to be away for 3 months. I'm going to be off for a month. Turns out we overlap by a week. But I'm petrified, because if I am alone with this kid for 3 weeks without any buffer, somebody's not going to make it through this. And I'm really worried about this. But thankfully, between the therapy and the sleep, the night nurse helping us, and also it turns out that my son was what's known as a fourth trimester baby, where the first 3 months of his life he was really fussy and very cranky, and as if to know that something very terrible was going to happen to somebody in this house. At around 10, 11 weeks, he stopped screaming and crying, and he cried when he was hungry or tired or pooped. And then he was kind of chill. And so the 3 weeks that I was alone with him were great weeks because I was solely responsible for him. He was a calmer kid. I was able to parent him and gain that self-efficacy, gain that ability to feed him and know his cues and take him in the car and take him to lunch with a friend or take him to see my parents. And it turned out that those 3 weeks were instrumental in getting me better. I'm not going to say that he went to daycare and I went back to work and everything was kosher. It still took, I still had my moments for the first year of his life, but it was so much better after that time. And if I wasn't a physician or I didn't work where I worked or I didn't have the ability the knowledge that I had or the connections that I had, I really wonder what would have happened and how this story might have played out. So that's my son. And I'm an only child, but my wife is one of three, and we had already said maybe we'd have another kid. But I was a little nervous about that. But eventually my wife won out and we had a second kid. My daughter was born in October of 2017, 4 years later, almost to the day. So, but the second time I'm ready. I'm like, all right, we're going to get a baby nurse from day one. I am going to make sure that I'm sleeping. If I sense anything, I'm going to start therapy faster. I even thought about starting therapy ahead of time, but I was like, nah, maybe it'll be okay. I got my son. I'm prepared for this. But as anybody knows who's dealt with women who've had this, you can be prepared and you can still end up having the depression again, which I did have. Only this time it wasn't as bad. And I should state that with my son, I actually had I had some very negative thoughts about him, thoughts that were of the homicidal, suicidal variety, which I didn't realize until later on when I did some television appearances and I spoke with some doctors who had asked me about my experiences. And I did not tell my wife these type of things because, again, I was worried about how she would view me and whether being that naked emotionally was a good thing or not. Because, again, I had to be a man and men don't do these things. But when I started making these appearances, I had to tell my wife about what I would talk about. And so I started to reveal things to her. And I didn't realize how close I had come to, like, I like to say I dipped a toe in psychosis. I mean, I was still aware of the thoughts. They didn't seem normal to me. But in those thoughts, I did some very physically violent things. And when I told my wife a little bit about those things, and to my wife's credit, and again, things that I wish that they were in front of my face, I just didn't want to accept them. She was upset, not that I didn't tell, not because I had the thoughts, but because if she had known, she would have been there to help me. And I think a lot of women, a lot of spouses would be like that if men would just be open about how they feel, that this is not an impediment to a relationship, it's an important thing in a relationship. So I was more nakedly open the second time, but it didn't stop anything from happening. But I didn't have the negative thoughts, but I did get angry, and I took it out on my wife this time because now she's the one who made me have this. Like, she knew this could happen, and she knew that I could go through this again, and she was selfish and she put herself first. And and I upset her. I mean, I was upset about the kid, but I wasn't upset with my son. But I was upset with the child, but especially my wife for making me feel this way. I started therapy earlier and I got over it faster. And I just got to the point where, as they say, I was sick and tired of being sick and tired. And I just remember saying to my wife, the amount of energy this is taking me to be this upset all the time is weakening me. And I know that there's a better way to do this. And I apologized to her. And you know, certainly by half the time. So if, let's say, by 1 year I was fine with my son, easily by 6 months I was fine with my daughter, and my daughter is now 2.5 years old, and I've been fine since then. But it was, you know, I prepared as best as I could, and I still couldn't stop it from happening, but at least I was aware of it. And during all this time, I became connected with Postpartum Support International as they started to realize that this is not just about women, it's about men too, and about families. But overall, I do hope my genes are recessive. This is one of my favorite Calvin and Hobbes comics, where Calvin says, "I've missed half of my TV show now. I hope you're happy." And Dad says, "You shouldn't be planning your life around TV anyway." Look, I don't think it's too much to ask that we sit together for 40 minutes without distractions and interruptions. Phone rings. Mom gets up. "I'll get it. I'm expecting a call." "Go ahead, Dad. I believe you were saying something funny." And he says, "I have all these great genes, but they're recessive. That's the problem here." And I actually do hope my genes are recessive, because I'd hope that my kids don't have to experience this. And I worry about that. And I know that at some point I will have to tell them about how Dad felt when they were born, and that it wasn't about them, it was about me. And that hopefully by educating them, when they become parents, they won't have to suffer what I suffered through. So what do you do? Well, at the time when I went through this, I did not know what to do. And for a little while afterwards, I wasn't exactly asking parents what was going on, how they were doing. But now I do. You don't do this. There's much better things to do. Screening, of course, is number one. Many of you may use the Edinburgh. You can use it on men too, but the cutoff score may be lower because men tend to really minimize their symptoms more so than women. There's some thought that maybe even a score of a 7 or 8 might be positive in a man, whereas 10 is for a woman. You can use the PHQ 2 or 9. You can use a Gotland scale for assessing male depression. But most importantly, address the father or the other partner and check for supports. Be honest. You know, a lot of times when I've done talks for nurses in the hospital, what we realize is most of the time when they come in to talk to if both parents are there, they really only focus on the mother. They don't address the father, and we're there. They don't address the other spouse, even if it's another mother, or a grandparent. It can happen to anybody. It doesn't have to be the biological parent. But if you don't educate, if you don't tell them that this is possible, and you don't even include that other partner as a 50% partner here, it subtly sends a message that you don't count as much, and what you may go through isn't as important, or you may not have anything. So these are just some information from the Postpartum Support website. So if anybody says, "I don't know what to do," you know what to do. PSI website, there's a helpline, staffed. Anybody can call to find out where resources are available in their state or even in their country. There is a button for resources for moms and for dads. This is the dad page. We have a chat with an expert the first Monday of every month, where men can call in to talk. There's tips, there's other websites. There's a dad's group on Facebook, which is monitored so trolls don't get on. Dad's mental health is an issue. The day after Father's Day is International Fatherhood's Mental Health Day, which I am involved in. It is a day to try to get the word out about dad's mental health and how important it is, and how family functioning is not just predicated on one parent, it is both parents. For those of you who are physicians or other providers, there is a perinatal psychiatric consult line. These are all free. You can use these if you encounter a parent where you may not be the prescribing physician or provider, but you need to know what to do. You can get in touch with a reproductive psychiatrist who will be able to help you and help that parent. These are some good websites. These are not bro sites. These are not, I mean, there's stuff on them, but these are legit sites that fathers can go to find out more from other dads about the things that they may be going through. There's a lot more available in 2020 than there was in 2013 for me. I like to end this with the story of Carol Coronado. I don't know if any of you are aware of who she is, but on May 20th of 2014 in California, Carol Coronado stabbed to death her 3 children under the age of 3. And she tried to kill herself, but she failed. And she was put in jail and denied She lost all of her attempts at overturning a guilty verdict by reason of insanity, because they would not find her insane, even though she most certainly was not of sound mind at the time. She had a history of mental illness and trauma, many adverse childhood experiences, with 3 children under the age of 3, and her husband, who I met, was not as available as he could have been. And after he heard me talk once, he came over to me and he gave me a hug and he said, "I wish I had known. I wish that I had known." Well, now hopefully all of you know, and you now know of somebody, even if it's just a voice through this webinar, who has experienced this as a father. And now if you see dads and other spouses and other partners, you will remember this and you will ask them how they're doing, and you will screen them and you will let them know that there are resources out there for men, for fathers who are experiencing profound mental health problems after the birth of their child, so that way they can make it through and they can be good dads and be good partners. And now you know, and knowing is half the battle. I'd like to thank you very much for letting me speak today. You can see if you need to contact me, feel free at my email, dlevine@smgnj.com. That's it.
Thank you so much for such an informative presentation, Dr. Levine, but most of all for sharing your personal experience. Thank you. We actually have several questions popping up, so I'll make sure, let's see, I'll share some with you. My first one, actually share a comment. Dr. Levine, your humor is hilarious. Thank you, and thank you for sharing terrific statistics.
Welcome.
One other woman actually shared that she took a domestic violence advocacy training, and that she felt information about fathers was missing. So that's maybe something to consider for DV trainings. And the first question here is, what technique did you receive during therapy that you felt was most helpful to you?
Yeah, so I did cognitive behavioral therapy with my therapist, and what she had me do was worksheets where she would challenge me in the office of, tell me what you're thinking your son has or what's the matter, and then asking me, well, if we asked 100 people if that was the case, what would they say? And if I was like, oh, I would have to be honest. I have to say, no, I don't think that that's what they would see. So I have to write all these things down. And every time a negative thought entered into my head, I have to write down the negative thought. I have to write down whether I thought this was something that other people would see the same way. And if not, what is it that they would see? And then I have to write that down. So I have to take the negative thought and then change it into the reality. That no, there wasn't something wrong, or no, he did not hate me, or he wasn't rejecting me. And another thing that they had me do was I would just wear a rubber band around my wrist, and every time I was at work or I was anywhere where I was getting these negative thoughts and it was getting into my head like these loops, I would take my rubber band, snap it to try to, just like a negative impulse to kind of snap me out of what I was thinking. Because that's what would happen. I would get into this. I would get upset by the way he was acting or crying, and then I would start thinking about these things, and then this, like, the therapist would say to me, she's like, you tell a lot of horror stories that you think are nonfiction, but they're actually fiction, and you have to realize that that's what you're seeing. It's that's what you're thinking, that this is not the reality. This is a fiction story that you're telling yourself. You have to be very careful and be very much aware of those things. And it takes a lot of practice to be aware and catch these thoughts. So the negative stimulus of the snapping of the rubber band was helpful for me to kind of, again, snap me out of it and start to see the thought for what it was, and not for reality.
Thank you. Thank you, Dr. Levine. Again, there's so many folks just thanking you for being so honest and for sharing your own personal accounts. This really has made this presentation so much richer. So thank you. There's another question. What about fathers who are concerned that if they do share their feelings, like you talked about with your doctor, that Child Protective Services would get involved? And this is especially true for certain cultures that are already disproportionately affected by having their children in the welfare system. What are your
Yes,
thoughts on that?
so that is very difficult, and I freely admit that as a Caucasian male who's also a physician, I probably, I mean, I'm not going to say I wasn't worried. You know, it's interesting that when I was in therapy, I wasn't necessarily as open about the more negative things. I revealed more of that almost during like these pre-interviews I would do before the some of the, as I was on the old Charlie Rose show on a parent, it was called The Brain and Parenting, and one of the women on there is a OBGYN who works in postpartum over at Columbia in the city. And she was the first person, like she actually asked me, like, did you have any like negative thoughts? And I told her, and she was the first person to say, wow, you really had some very vivid thoughts in your head that I wasn't aware about how bad that was to have. And I never said that to a therapist. And I think part of it was I was a little afraid. But another person that I did when I was on that show, what he said was thoughts are not actions, and therefore just because you think something doesn't mean you're doing something. It wasn't like I was having murder fantasies or going into extreme detail, and I don't even know if I had done that, if that would have necessarily led to a call from somebody. But I get that there would be a real fear if you're a father, especially if you're in a minority community, of revealing this. I think it's who you reveal it to. I think it's hard, as we all know, mental health care is very lacking in this country, and it's hard to find anybody who you can talk to who will see this the right way. I know a lot of women get very nervous about revealing certain things because they're afraid that their child will be taken from them, because it has actually happened. I think that's where PSI kind of comes in, because if you're contacting us and we're putting you in touch with providers in the area, these are providers who are trained in this, and they're not going to just be like, Child Protective Services is going to come to your door. I actually, before I was involved with this, I actually made that mistake, and I didn't do it intentionally. There was a mother who failed her Edinburghs terribly, was missing a lot of visits, acting very strange. I did not know what to do, and I actually reached out to Child Protective Services because I told them, I'm just worried that the mother is having a hard time, and can you please check on them? And of course, it did not go over very well. In hindsight, I should not have done that. And if it was today, I would never have called them. I would have, now I know more resources, I would have reached out to resources and I would have kept them on the phone. And that's what I've done subsequently. And it upset the family quite a bit because no one likes to see someone like that pop up at your door. I think it's a lot of legwork to convince certain populations that these people are here to help you and that you don't need to be worried about that. It's finding the right community groups that they can link to, and just putting them in a position where they feel comfortable talking about it, where they know that that is not going to happen. But that's a very tough question, and I wish I had a better answer for it. But I think it just comes down to educating the family ahead of time, and then making sure that, and I take this as a personal responsibility for pediatricians because we see families the most, for pediatricians to be aware of this and know who that they can turn to get these people help.
Thank you. Thank you. Yeah, very tough situation, but I agree with you. I think linking up to trusted, well-established organizations that work in the community are key to receive support and education to make sure that messages are out there as to what are the resources available for folks. So here's another question. As a pediatrician, you know, you have limited time and your focus is obviously on the baby. How do you actually start a conversation with a dad about his emotional well-being? How do you bring it up? Is there a script that you use? What kind of tips can you provide other providers?
Right. So for better or worse, because I've gone through this, I can lead with my own story. So what I do for all, because I usually will see both parents for the first maybe 2 or 3 visits. So what I do from the get-go, because most of the time in those visits, seeing the baby takes like a minute or two. It's mostly answering questions, making sure that the feeding's going okay. So there's a chance to do this. And in my office, we screen both parents. Like we give the MA gives them the Edinburgh as soon as they come in. They are asked to fill it out while the MA is taking the measurements and putting everything in the computer. So most of the time, by the time I walk in, I already have the scores waiting for me. And then once we get through all the questions that everybody has, I just carve out the last like 2 or 3 minutes just to say, I want you guys to know about postpartum depression. And I look at both parents. I say it could happen to both of you. And I tell them it's happened to me with both of my children, and that there are resources that we have. And I tell them that you have to work together, that this can be great, but it can be very difficult too. I quickly educate them that it can look very different in men and women, that men can be very uncomfortable talking about these things, which usually leads to a smirk by the mother and a nod by the father. And that I tell them that what I always end with is this. I tell them that you don't score any points with me by telling me that everything's going great, and then as soon as you leave here, you start crying. And I said that it's a team, and both of you need to be together to raise a healthy family. And I tell them that now that you know that this has happened to me, I hope that this takes away any worries that you might have to bring it up to me at subsequent visits. And they usually say thank you for letting me know, and I just reinforce it for the next 6 months.
Excellent. Thank you. Thank you. One of the registrants, I think she wants clarification on the support services for Postpartum Support International. She wants to know whether PSI links families to support for both women and men, or is it just for men?
It's for both. Postpartum support is for both gender, for both parents, both partners. They do not differentiate, although most of the people most of it is for women. Anybody that has any training, because now what they have is that there are people who've taken the course that are therapists who are specifically trained and get a certification from us. They have gone through our training, and it involves information about mothers and fathers. So anybody that is someone that we could put someone in touch with is certified to work with both genders. The site that you see on your screen right now, all you have to do is it's postpartum.net. The parent can go there. You can go there and take a look at the site. You'll see the information for both parents, but it is for entire families.
Perfect. Thank you for clarifying. I have just 2 more questions for you, and then we will end. There is someone here asking about guidance for providers when it comes to paternal depression screening. I know you mentioned during your presentation that cutoff scores may need to be lowered for men. However, she would like where can you direct her to some research results for that cutoff score for the EPDS? Is there new research on this topic that could help her?
I would probably ask the person to email me, because there's not a lot of good data, but I do have it somewhere on a computer that I could then share with them. So I can give them a little bit of information on that, because there's a couple of people who are bigger into research into these areas who have that bit of data that I can share.
Okay, wonderful, thank you. And our last question is, can you talk a little bit more about, or actually talk about supporting fathers who experience an infant loss?
Yes, so that's a kind of subset of this. How should I start? If it's something that occurred in the NICU, so preemies or something that happens in the hospitals have a lot of resources for that. If it is something which is like a SIDS, or it's a child who was born who was unfortunately passed away from a disease of some kind, there's usually a lot of grief services that are available, and there are grief services in communities that are specific for children, for losses of children. In fact, there is I think it's called COPE. There's actually a group. There's the Postpartum Support International of that is called COPE, COPE, because my wife has a friend whose family member lost a child. And there's a good websites and there's good support for that. If it's specifically infant loss, which is what I think we're talking more about, postpartum support would definitely be able to help with that as well.
Okay, thank you. Thank you so much. And thank you to all that asked some really great questions and also provided some great feedback. So again, Dr. Levine, thank you for being with us today. If you had more questions or are in need of more information, please use the contact information listed in the presentation, or you can contact us at the partnership at info@partnershipmch.org. Don't forget to visit the partnership's website to learn more about our perinatal mood disorders initiative and to obtain our most recent educational resource for fathers, which includes information on men's emotional well-being, tips, and resources. A final reminder that in about an hour, you will receive an email with a link to a post-program evaluation, and your feedback is important, so please take the time to complete it. Certificates of completion will be sent via the email you provide on the evaluation, so please check to make sure it is correct and should be received within 1 week. Lastly, a calendar of the partnership's upcoming virtual programs can be found at the partnership's website, partnershipmch.org, under the Professional Education tab. We encourage you to share today's and other webinars listed there with your social networks. Our next talk, Postpartum OCD, Making Sense of Scary Thoughts, is scheduled for next Thursday, May 21st. I hope you can tune in, and I wish you all a wonderful day. Thank you.